So this is your, okay, first of all, do you want to do any particular thing or should I just give you randomly?
I think you choose the development for me.
Okay, all right. So this is the scenario. It's a 5-year-old boy. His name is Harry. He's come with a history of speech delay. And you have to take the history from his mother, Mrs. Sarah, and do a speech and language.
पानी की बोतल भी अंदर से ले अपना.
Everyone else, please mute yourself, okay, during the talk.
Okay, so good evening. Is this Mrs. Sarah, Harry's mother?
Yes, I'm Sarah.
Okay, good evening, Sarah.
Good evening, doctor.
I'm here. I'm Dr. Nida, one of the child doctor in the hospital, and I'm here to take notes regarding Harry's condition. So, will you tell me about your concern regarding Harry?
Yes, doctor. He is not speaking at all. You know, like other kids are speaking to their parents, he doesn't speak at all.
Okay. So, since when you noticed that he is not speaking at all?
Actually, I mean, he was under speech therapy and he started speaking, but since past 6 months, his speech has really gone down.
Okay. Since past 6 months, he is not able to speak even a word?
No, he does say sometimes one word, but most of the time he doesn't respond verbally.
Okay. So what have you done so far for this?
The pediatrician has referred us to the ENT doctor, and he also got the hearing checked as well.
And how was the test?
They said there's something wrong with his hearing.
Okay. So hearing test is not right. So has he been given any aid for that, for hearing?
Yeah, the ENT surgeon said they might do some surgery for him. I'm not sure exactly what.
Okay. So does Harry look like you or your partner?
Yeah, he looks like both of us.
Okay. Have you observed any loss of skills like he was doing before and now he's not doing that? Any concern like this?
Yes, as I told you, before he was speaking a bit better, now he's gone back.
Okay. And will you tell me when he started to walk?
Yeah, he was about 15 months of age.
Okay. So right now he's rides a tricycle or?
Yeah, he can do a tricycle, yes.
Hello?
He can do it.
Okay,
Yeah.
he can ride a cycle, right? And any concern with his walk or he's able to jump, walk?
Yeah, he can jump. I don't have any concern about that.
Okay, very nice. Can you tell me, is he able to draw anything on the paper?
Yeah, he likes to draw like cars, animals, different type of.
Okay, okay, okay. Very nice. Does he indicate his need for like pee or he's still in diapers?
No, he's come out of diapers just now. He goes to the toilet as well.
Okay. So, Mrs. Sarah, will you tell me anything or any problem regarding in pregnancy when you were pregnant with Harry? Was there any problem before pregnancy?
During the
Before his
pregnancy,
delivery, yeah.
okay, I had a bit of infection towards the end. That's all.
Okay. So, what was infection?
I had a urine infection, and then it spread to the womb, I think.
What?
Womb.
Sorry.
Womb.
Okay.
The baby got the infection from me, they said.
He also got the infection?
Yes.
And how, after birth, like he was admitted in hospital?
Admitted for about 10 days.
For 10 days. So after, when he was discharged, were you advised any hearing test for him at that time?
Yeah, they did the hearing test at that time, and they said there was an issue with his hearing.
Okay, it means since birth he had issue, or some medicine got during his admission which causes issue. Are you aware of that?
They did some levels. Yeah, they said it was a bit high, one of the antibiotic levels.
Okay, and they told you that this is the reason why his hearing is not good.
Yeah, they did tell us that if the level is high, it might affect his hearing. That's why we've tested it. But they didn't say this was the only reason. I mean, they said it might be due to some other cause as well.
Okay, okay. So can you tell me what infection was he, like he was having any infection, any bug in the brain, or
yeah, he had the infection in the brain.
Were you aware of that? Do you remember?
Brain
in the brain he has infection, and he was all right after 10 days.
Yes, 3 minutes left. After 10 days, we came back for the injections and then the test, but he was released on the 10th day. 3 minutes left.
Okay. Okay. So can you tell me who are in your family? How many children you have?
She's 10 years old, and it's Harry.
Okay. And you and your partner lives together?
Yes.
Which language you speak in at home?
We speak English and French.
Okay. So any problems with finances?
No.
Okay. So what impact are you having, I mean, on family, like when Harry is not speaking? I mean, are you getting disturbed by this, or you need extra help for that?
Yeah, he's actually it's affecting our social life because he's throwing tantrums a lot nowadays, doctor.
Okay. So you avoid taking him outside?
Yes, to mingle with our family and friends, because he's always throwing tantrums.
Okay. He's good. I mean, he's making friends. He's good socially. I mean, he loves to meet people, or he likes to live alone and play alone.
No, he likes to play with kids, but yeah, the tantrums have become a problem for us.
Okay. Is he going to school?
Yeah, he goes to preschool.
And how they are dealing with this problem? I mean, he cannot speak. So is he going to any special school?
Having issues with him, communicating with him and all that.
Okay. So any extra support you need for this, for educating him, for making things learn
put him
for
in
him?
front of the class. That's the only thing she told me. I've tried to make him sit in front because he just doesn't pay attention.
How he communicates with you, and he needs to how he asks you things.
Okay, this is you're encroaching into the speech thing, right? So you can ask specifically what you want to ask.
Okay. 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 Sorry. Any other concern, Mrs. Sarah, you like to tell me, which I have not covered? Would you like to share with me?
Yeah, his school performance has gone down, doctor. Okay, time is over. Summarize your case.
Okay, so I have taken notes from Harry, who is 5 years old boy, from his mother. The main chief complaint is he's having speech delay, and she has told me regarding the significant admission after birth for 10 days in the hospital, and discharge, the hearing test was done, which was also not normal. But since 6 months, she has noted that he cannot speak at all. Other domains are normal, and family is getting disturbed by this, as they are compromising going socially, and Harry is throwing, because Harry is throwing tantrum, his education is also affected, and the speech delay is likely due to the
Okay, time is
hearing
over.
loss. Hearing
All
loss.
right.
Yeah.
Okay, let's go to the assessment. Start.
Okay. So I would enter the room, and can you tell me what regarding Harry? Is he wearing any glasses? Is any devices attached to Harry?
Yeah, he's wearing a hearing aid.
Okay. And what is he doing right now?
He is sitting with the cars and playing with them.
Okay. Okay. So now I will go behind and will stand behind Harry and will whisper in his ear his name. Is he able to listen, Harry? Harry?
No.
Okay. Now I will come in front of him, and I will I will name him Harry. Is he doing eye contact with me?
Yes, when you come in front, he can see you.
Okay. How are you?
No response.
What is your name?
No response.
What is your name? Okay, let's read a book. What about this, Harry? Let's read a book.
Okay, so how are you going to engage him?
Okay, so I have a book in which there are some cards and some fruits. Can you tell me, Harry, what is this? Which this is card or a box?
He just points
Harry.
to the car. He points to the car. That's all he does.
Okay. So this is car. Okay. Which one is big car? This one and this one.
He shows the big car.
Okay. Okay. So Harry, can you put this glass on the table? Take this glass and put on the table.
Yes.
Okay.
You can do that.
Okay. So let's do this. Can you tell me where is your nose, Harry?
He points to his nose.
Okay. Where are your hands?
He shows his hands.
Very nice. Where are your eyes?
Points to the eyes.
Okay. Knees? Where is your leg?
Points to the leg.
Okay, very nice. Can you sing a song with me, Harry? Can you sing a poem with me? Twinkle, twinkle.
He doesn't sing.
Okay. Okay. I think I'm done with the assessment.
Okay.
How much left time?
You have a lot of time left. 5 minutes.
Oh. Oh. Okay.
I gave you a single task, but you need to do it thoroughly. Okay. Okay. So give me your assessment age.
Okay. So I assessed him, and on expressive speech, he could not say a word, and but his expressive, but his receptive speech is age appropriate, as he was able to tell the opposites, as he was able to tell the 5 parts of the body, and he was able to do two task command, and also he was able to point out the objects, and he was able to interpret the prepositions. So receptive.
So at 5 years, in the receptive, how much can you do? I mean, only 2-step commands?
2-step command, preposition, opposites, parts of the body.
All this is actually like around 3 years, okay? The comparatives you did, big car was 4 years, but opposites you never did. Opposite is actually a verbal response. Did you ask the opposites even? I don't think so. Did you ask? What did you ask?
I asked opposite. I think big or small. I asked something.
That is comparative. Okay, that is receptive speech and comparative. Opposite something that expressive. Yeah. Okay. All right. So, what is the discrepancy between his expressive? The cause of discrepancy between his expressive and receptive speech?
Because he. Because he is not delayed developmentally, he can understand age appropriately, but because of hearing loss, he cannot articulate the speech.
Okay, so what is the cause of the hearing loss?
The cause of the hearing loss may be post-meningitis sequelae, or maybe due to some drug toxicity which he received during postnatal period.
Okay, but the mother says that he did have some speech problems initially. He was under speech therapy, and then in the past 6 months, he's not saying anything. What do you think is the cause?
Sensorineural hearing loss he is having.
Do you think sensorineural hearing loss, he'll be wearing a hearing aid?
Oh, yes. Sorry, conductor. No, sorry.
Yeah, so what questions you needed to ask in the history?
I didn't ask for the chronic otitis media.
Yes. Also, what other history you needed to ask? Did you ask about family history of hearing loss?
No. I didn't. I wrote it, but I didn't ask, right? I missed it.
It could be congenital deafness. You don't know the child was born deaf and the screening test came positive because of congenital deafness, not because of acquired causes. It could be both actually. All right. So what can you do for this child? First, how would you like to investigate?
So I will do a multidisciplinary meeting with a ENT, with a speech therapist, and with a pediatrician. As
okay, that's how you manage. But what investigations you'll do? Baseline, any investigations? And then you can say who you can involve during the investigations as well.
I'm sorry, I'm clueless regarding investigations right now.
So you need to do a formal hearing test, find out is it sensorineural, is it mixed hearing loss? Probably he has mixed hearing loss. And you will involve an ENT specialist. Some places the ENT does the audiology assessment. In UK, the audiologist does it. So formal hearing, vision, do the full assessment of the child, developmental assessment. We need to also rule out autism. He's throwing temper tantrums, but you didn't ask except for the playing with other kids and eye contact. Did you ask about anything else?
Yeah, I didn't ask about the repetitive task behavior. I didn't ask that.
Yeah, rigid routine and all that. So you need to
Yes.
ask rule out autism as well in any case of speech delay. All right. So what else will you? Who else will you involve? And what will the ENT guy do?
Maybe cochlear transplant.
Okay, for the sensory neural hearing loss. Yes. If he has a mixed hearing loss, he might do a
I
Gome
don't know.
insertion, right? If he has a chronic suppurative otitis media,
Yes.
Gome insertion. Okay.
Okay.
All right. So, okay. So, speech therapy and any other therapy he might need.
Speech therapy and for his education.
Sorry.
For
For
his
what will you
education.
do for the education? What are you going to say specifically?
Education, healthcare.
Yeah, say it. You needed to ask even the mother, do you have a healthcare plan? All right, so one is that, and also the child may require educational support. But for his temper tantrums, what are you going to do?
Behavioral therapy. Educate
Yeah,
the parents as well as the child how to deal with him when he throws tantrum. So we have to educate the parents as well as we'll do the behavioral therapy of the child.
okay, so who will do the behavioral therapy?
Psychologist.
Yes, psychologist. You can't think like this in the exam, okay? You have to say it very fast. I've given you all the 5 minutes of
Yeah.
time here. So
I know I am doing really bad, but I couldn't. I mean, I know all these things, but I couldn't.
this is like
Say them.
the single task I gave you, so it's pretty easy to do a single task in the time limit. But if you get a double task, imagine what will happen.
Yeah. Right.
Just need to practice more, okay? Be smoother. Otherwise, you can do it. It's not that hard. Development, once you get the hang of it, it becomes easier.
Yeah.
Okay, so let me give you some feedback.
Yeah.
In the history, as I said, you needed to ask rule out autism, so any behavioral issues other than temper tantrums. Okay, and also you asked, didn't ask during the assessment, when did he say his first word? So he did have speech delay, okay? Normally, people forget to ask about the initial milestones, okay? If you have a single task, and you had so much time, you can ask about the speech, when did he say the first word? Because if initial speech delay is there, this means it's something from the beginning. You can't ask that in the, you can only ask when you first noticed it, but she's mainly complaining about the past 6 months, so you can't go further into it. All right, so, and then you needed to ask more about, if suppose he has, any abnormal behavior, what other things you will ask about other than the rigid routine and repetitive behavior? Anything else? He might have some comorbidities like fits or something if he has autism, or even if he had meningitis, you needed to do some systemic review, okay?
Yeah, I didn't do the systemic review at all.
Yes. So that always remember you need to do a pretty thorough history. If you're having a positive history in one aspect, then you need to ask further questions, okay? Who's he following up with? What has been done for him? What tests have been done? Everything you have to ask, okay? All right, so we'll go to the next thing.
Dr. Mohammadi?